Hey Upstate, your local pelvic health physical therapist Yvonne and Sabina here, again to give you an instructional and educational video. Today's subject is very important, male sexual abuse, and how it can lead to a lot of dysfunction. In fact, some of the research is showing that reports of 1 in 6 men have been sexually abused or assaulted in their lifetime. And that can lead to...
Yeah, it can lead to a lot, and that's really a remarkable number there, and it kind of makes us really upset to think about 1 in 6 men experience some kind of sexual abuse in their life. But not only are we looking at depression, anxiety, isolation, men don't talk about it. It's something that maybe had happened when they were younger. It comes up when they meet that girl and they get married. It might come up when they have children. So we got a lot of depression, emotional, but we also have a lot of physical impairments as well. So men tend to have pelvic pain issues that sometimes they don't talk about to the doctor about. Intimacy is a big one that we're definitely going to address in terms of therapy. It can be painful. The desire is less. And then we're looking at bowel and bladder dysfunction. Men a lot of times will have problems urinating. Defecation, which is a bowel movement, can also be a problem. A lot of men deal with constipation, diarrhea, painful to have a bowel movement altogether. And then going back to the pelvic pain, which can be a huge factor in a lot of men. And like I said, they don't discuss it, they don't talk about it, and then it becomes a problem when they're in their middle ages and even beyond that. So we see men, younger men who are having problems all the way up to seniors.
Yeah, so we're going to talk a little bit about how we as physical therapists can help. We're going to review some of the anatomy and even some of the outcomes that we get. So let's start with a review of the male anatomy. So here's our nice little handy dandy model. We have the pubic symphysis here, so this is the front part, and then we have the sacrum and the coccyx, and that's the back part, okay? So in the front part, we have the penis exiting the anterior as well as the scrotum, and then we have the prostate and the bladder. And then right behind that is the rectum and the anus. And right above the shaft, we can see a nice layer of pelvic floor muscles. And those muscles help stabilize, they help with sexual function, they help allow urine and bowels to exit the body, and they're very important to maintain and be aware of in order to maintain all of our function.
Yeah, so in terms of pelvic health therapy, it's something that sometimes, doctors can refer patients to, but many states like South Carolina, it's a direct access, so men can find us. Google, but pelvic health therapists are a really, really important factor when it comes to educating men on their body. We teach the anatomy with examinations, both external and internal. Mm-hmm. We also use treatment tools like biofeedback, which is a really important tool. Some of the biofeedback is externally. We put pads on the external genitalia, and then you're able to actually see and fire the pelvic floor so you can see it on the screen. We teach men how to relax their perineum, both manually and through the biofeedback, which is really, really helpful for pain relief. It also helps with bladder and bowel dysfunction. Treatments can last 45 minutes to an hour, depending on the therapist and the setting that you're at. And some men do very well after 2 or 3 sessions. They see themselves able to urinate better, defecate better, and have intimacy with less problems and pain. Some men need therapy a little bit longer. It just really depends on how long it's been going on, and of course the emotional and the physical have to be taken care of, and that's what we do. And our outcomes are amazing. Men do fabulous with it. It does take a little bit of education and hands-on therapy, but our outcomes are really, in the course of, I guess, 20-some years that I've been doing it, I've seen some fabulous results with men's health. So I definitely would recommend it. I would encourage men to seek help. We're always here. We're here through telehealth marketing that can be available if you're not able to get to a therapist. If you're not able to get to us, we do telehealth. And we also have physical appointments that are available as well.
We also, if you have any questions regarding physical therapy or your issues, you can always give us a call, and we offer free 15-minute phone consultations with one of us as well. So you're not alone. We are here to help. This is a very prevalent issue that can be addressed. And again, like Sabina said, we have great outcomes. So thank y'all for listening.
Thank you.
And have a great day.
Bye.